I'm going to show you and share with you some important findings that we made studying patients affected by this new form of hematological disorder that affect platelet count. And as you can understand by the title of my presentation, is much more dangerous than it seems. Let me spend some word about what inherited thrombocytopenia are. First of all, they are familial disorder, and they are characterized by low platelet count. As you can see, and as you know, platelets are small blood cells, but even if they are small, they are fundamental for hemostasis. In fact, our patients often present with bleeding complication, but the degree of bleeding symptoms is usually mild. That's the reason why everybody thinks this disorder are not so dangerous and are benign condition. Is that true? In 2015, together with other groups, we described this new form of inherited thrombocytopenia due to germline mutation in the ETV6 gene. So we call it ETV6-related thrombocytopenia. Obviously, it's a hematological disorder characterized by low platelet count. It is inherited, so it is transmitted by one of the parents. That's what we call autosomal dominant inheritance manner. They have got mild bleeding symptoms, our patients. And there are no morphological or functional abnormalities of platelets that can guide us toward the diagnosis. Usually, inherited thrombocytopenias are characterized by very large platelets, even giant platelets. But we found out that there is a higher risk of developing blood cancer, and in particular, acute lymphoblastic leukemia. That's the incidence rate of acute lymphoblastic leukemia in our population of ETV6-related thrombocytopenia patients compared to general population. I will translate what you are seeing here. It means that almost 1 out of 100 patients affected by ETV6-RT will develop, surely, acute lymphoblastic leukemia every year, while in general population, 1 out of 10,000 people will develop it. So what should we do? Of course, we have to suspect ETV6-related thrombocytopenia every time a patient has an autosomal dominant inherited thrombocytopenia, but without platelet macrocytosis. We have to confirm the diagnosis using genetic analysis. And much more importantly, we have to program an appropriate follow-up regimen. Since acute lymphoblastic leukemia does occur in time of months and not days, it's reasonable to perform blood cell count and peripheral blood smear evaluation every 6-12 months. So this is my take-home message for you. When we are talking about ETV6-related thrombocytopenia patients, we must pay more attention to this hidden but very dangerous risk of developing blood cancer, so that we can define prognosis and personalized follow-up regimen, than to bleeding complications, which are rare and usually do not affect the quality of life of our patients.